So yesterday I told you that you will be telling me all the six extraordinary food organ. What is the uterus? एक तो यूटरस है। हमारे शरीर में टीसीएम के अनुसार 6 एक्स्ट्राऑर्डिनरी यांग ऑर्गन है। फू ऑर्गन, फू मीन्स यांग, झांग फू, झांग एंड फू, फू मीन्स यांग। बड़ा कंफ्यूजन होता है कभी कहते झांग, झांग ऐसे लगता है जैसे यांग है ना, लेकिन झांग का मतलब है यिन और फू मतलब है यांग, है ना। सो झांग फू like yin yang. In the same way, Zhang Fu. Zhang means yin, Fu means yang. So in the human body, there are six very special yang organ, very extraordinary yang organs. Six. One is uterus. The second is brain, super yang. Brain is the second of extraordinary fu organ. Number three, bones. Without the bone, you cannot imagine. अगर हमारे पास बोन ना हो तो हम कैसे खड़े होंगे। सारी बोन निकाल दो तो जमीन में ऐसे लुढ़क लुढ़क के चलेंगे। बोन्स आर द वेरी इंपॉर्टेंट as per TCM. Then the fourth one is bone marrow. Inside the bone, there is a bone marrow, which is the factory of blood cells. Bone marrow हमारे blood cells की factory है. It's a extraordinary area. Then blood vessels, very important. Okay. Then the one more that is gallbladder. Gallbladder. So these all are extraordinary two organ: uterus, brain, bone marrow, bone, blood vessels, and the gallbladder. So uterus we have discussed. Uterus is really extraordinary and having connections with the many meridians. Like we know spleen meridian, liver meridian, kidney meridian in coming from the legs. हमारे पैरों में से 3 मेरिडियन आते हैं, liver, spleen and kidney. Uterus having connection with the Ren meridian, Chong meridian, even the heart. Okay. So whenever you are thinking for the uterine problem, you have to think for these all meridians. यूट्रस को केवल किडनी मत समझ लेना या यूट्रस को केवल लिवर मत समझ लेना. like ovulation of the, जब ovulation होता है on the day 14, on the day 14 when there is ovulation, during the day of ovulation the female body temperature is rising with 1 degree. ओके, फीमेल के बॉडी का टेम्परेचर 1 डिग्री राइज होता है. कौन से दिन? ऑन द डे 14, ऑन द डे ऑफ ओवुलेशन. सो द हार्ट इज सेंडिंग द हीट, द हार्ट yang is coming. Without the heart, ovulation cannot happen. Uterus is very good, ovum is very good, everything is very good, but heart yang is not there. Heart is weak, ovulation will not happen. Okay. So when you think for uterus, just don't think, okay, kidney, okay, liver, no. Uterus having connection with these all meridian, even the single meridian might create some problem with the uterus. So whenever we are planning the treatment of uterus, we are seeing which one is disturbed. Okay, kidney is okay, done. Spleen is okay, done. Liver is okay, done. Heart is okay, Chong Mai is okay, Ren is okay, then uterus will be okay. Even the single meridian is disturbed, it will create problem. For example, the disturbance of the spleen might create uterine prolapse and the white discharge. स्प्लीन की कमजोरी से यूट्राइन प्रोलैप्स हो सकता है. With the problem of the liver, there might be dysmenorrhea or the painful menstruation. लिवर की प्रॉब्लम से डिसमेनोरिया हो सकता है. द प्रॉब्लम विद द हार्ट, देयर विल नॉट बी ओवुलेशन, ओवुलेशन ही नहीं होगा. Chong Mai meridian is a very important meridian we will be discussing today. Then the Ren meridian and the kidney meridian also supplying yin to uterus. Now regarding the brain, brain is the second extraordinary food organ. So when we talk about the brain, we think about the heart as well as the kidney. If you want to treat the brain, you need to treat the heart. You need to treat the kidney. Kidney is making the bone and bone marrow. Kidney बनाती है bone और bone marrow. And the bone marrow is making the brain. So you want to treat the brain? Okay. Treat kidney as well as the heart. Okay, heart is directly having connection with our mental functioning. So like for the uterus, we are treating too many channels. हम यूटरस के लिए तो कितने सारे चैनल्स को ट्रीट कर रहे हैं. For brain also, we will be treating many channels like heart and kidney. Now coming to the bone marrow, 1 minute. Excuse me. Now regarding the marrow, bone marrow, we know what is bone marrow. Inside the bone, bone marrow is very important. We are telling this extraordinary food organ, this bone marrow. Inside the bone, there is a factory which is making RBC, WBC, platelet. But most important, this bone marrow is making brain and spinal cord. And we are very much aware, brain and spinal cord are the root of the human body. If there is any problem in the brain or the spinal cord, it will disturb our entire destiny. Okay, spinal cord is very important. We are not talking about the just lower back pain, middle back pain, upper back pain. We are telling if there is an injury of the spinal cord, even person might suffer with a paraplegia, no control on the urine, even not able to walk. Spine is the second brain. So bone marrow is very much important, which is making brain and the spinal cord. और आजकल तो बोन मैरो बहुत इंपॉर्टेंट है क्योंकि सिर के बाल भी बनाती है. अगर सिर के बाल झड़ जाएं तो आधी तो डेस्टिनी वहीं खत्म हो जाती है ना. So that's why bone marrow is very much important. Okay. So bone marrow is having connection with the brain, spinal cord. Okay. सिर के बाल वाली बात मजाक में लेना. And it's connected with the kidney meridian. Okay. You want to strengthen the bone. You want to strengthen the bone marrow, work on the kidney meridian. Now bone are very much important. Just we have seen it's having connection with the kidney. If the kidney is good, your bones will be good. Bone are the framework of the human body. Now coming to the blood vessels. The blood vessels are very much important because continuous supplying the blood throughout the body and very closely related with the meridian, that is kidney meridian. ब्लड वेसल्स किडनी मेरिडियन से कैसे कनेक्टेड है? कैसे? सोचिए. What is the connection of the blood vessels with the kidney meridian? क्योंकि पहले तो हार्ट मेरिडियन आता है हमारे दिमाग में, है ना, हार्ट ही तो आएगा. But blood vessels is very deeply connected with the kidney meridian because if there is we want to increase the blood volume, kidney will increase the blood volume by absorbing more water. We want to decrease the blood volume, kidney will do that. Okay. Kidney is also responsible for the productions of some, indirectly we have seen kidney is making bone marrow and where the production of blood cells happening. So whatever we want to do means blood vessels is indirectly having very deeper connection with the kidney. So blood vessels also coming in our extraordinary two organ. Now the last is gallbladder. So the gallbladder, we know the store the bile and it's also having connection with the kidney meridian. Kidney meridian is a very common meridian. We can see in all the extraordinary 6 organ, kidney meridian is having connection. So gallbladder is also having connection with the kidney meridian. How the gallbladder having connection with the kidney meridian? Because gallbladder means decision making power. Gallbladder means if you see the meridian, the gallbladder meridian encircling the brain. Okay. So हमारे gallbladder को जो ताकत है वो किडनी मेरिडियन ही देता. Gallbladder is doing yang function with the power of kidney. Gallbladder is, we are telling, okay, the person is having very big gallbladder. Big gallbladder means good decision making power. Okay, big gallbladder means is not that we are telling the organ is big. जब हम बोलते हैं कि gallbladder organ, अरे इसका तो gallbladder बहुत बड़ा है, इसका अर्थ है उसकी decision making power अच्छी है. Okay, in this way they are the extraordinary food organ. Now we are coming to the uterus. Other will be written in the notes, but we will be discussing uterus. Yeah, the all are written in the notes. But here our primary target is uterus. So the most significant extraordinary organ, okay. So controlled by the kidney, Ren meridian and the Chong meridian primarily. मुख्य रूप से जो किडनी मेरिडियन, रैन मेरिडियन और द चोंग मेरिडियन प्रभावित करता है. Okay. So the three meridian. Here Chong Mo meridian is the very important meridian. So we will be discussing little bit about the Chong Mo meridian now. क्योंकि हमारी किडनी को प्रभावित कर, हमारे यूट्रस को प्रभावित करने वाले बहुत सारे मेरिडियन हैं, लेकिन चोंगमो उसमें से एक बहुत ही महत्वपूर्ण है. चोंगमो. So now I will bring your focus on Chong Mai. So first see one diagram here. So look at this diagram. So this is the kidney number 1. This is the kidney number 2. In between both the kidney, we are having one force and it's written motive force. क्या लिखा है? Motive force. Okay. In between both the kidney, we are having one motive force, or we are having one power which we are bringing from the birth and which is residing in between the kidney. Okay. Now this motive force is traveling through Chong Mai. ये जो मोटिव फोर्स है जो दोनों किडनी के बीच में है, ये चोंग में के थ्रू अब ट्रेवल करेगी. Okay, so first number we can see the this motive force is going in the uterus. Okay, so this is the step number 1. What is the step number 1? One motive force between the kidney, from the kidney coming and entering in the uterus. Okay, good. Second thing, on the back side we can see there is a DU meridian. On the front side we can see there is a REN meridian. Okay, so this is the REN, and this, on the back side there is a DU. And this is the, we can see this is made by the green color. This is the Chong Mai. Now look at this image once again. Very important image. We can see on the top we are having heart. All the 3 forces are meeting in the heart. So the REN is going in the heart, DU going in the heart, even the Chong Mai is going in the heart. All the 3 forces are going in the heart, as well as all the 3 forces coming in the uterus. So the heart, and in the top we are having heart, in the bottom we are having uterus. Both are connected by the DU vessel, by the REN vessel, and by the Chong Mai vessel. Yes. So here Chong Mai play very much important role. Definitely other also play important role. दूसरे भी important role play करते हैं. लेकिन पहला हमारा लक्ष्य है Chong Mai. We will be discussing all things one by one. But first we are going to discuss Chong Mai. I will tell you what is Chong Mai. In the human body there are total how many meridian? 20 meridian, right? Am I right? 20 meridian. There might be 73 meridian, but 20 are the main. So I will write here. In the human body, there are 73 energy meridian, but the 20 are main. In the 20, 12 are the main meridian and 8 extraordinary meridian. In the 12 meridian, we have 6 yin, 6 yang, like lung, large intestine, okay, spleen and stomach, heart and small intestine, kidney and UV, pericardium and triple valve, liver and gallbladder. These are the 12 meridian. Okay. And there are 8 extraordinary meridian. DU meridian, REN meridian, Chong Mai meridian. In this way, there are total 8 extraordinary meridian, like yin heel vessel, yang heel vessel, and all and all. But these three vessels are having deeper connection with the uterus. And on the other side, if we see the spleen meridian, kidney meridian, liver meridian, and the heart meridian are having connection with the uterus. So our focus will be this. Okay. So now I'm coming to the extraordinary meridian. In the extraordinary meridian, if we talk about the Chong Mai, Chong Mai is the very special meridian on the top having connection with the heart, in the bottom having connection with the uterus. If the person is suffering with a problem of palpitation, high blood pressure, okay, or maybe heart rate is disturbing, suddenly chest pain, any problem of the heart, we will use Chong Mai and it will give instant result. On the other side, if the female is suffering with the problem of uterus, with a painful menstruation, with any type of the uterine problem, we will be we want to treat the PCOS, polycystic ovary, or any problem of the uterus and ovary, we will be treated by the Chong Mai. So Chong Mai is the vessel having connection with the heart as well as the uterus. I have given this example many times. One patient was having chest pain. I was doing some treatment, and one patient was sitting in the queue and suddenly got chest pain, and it was looking like he's going toward the heart attack. This patient was taking daily high blood pressure medicine, but that day he forgot because he wanted to visit me, he wanted to visit clinic, he wanted to so उसने सोचा कि आज दवा नहीं खाते हैं क्योंकि डॉक्टर साहब पल्स देखेंगे, और तो उनको मेरी एक बिना मेडिसिन के क्या कंडीशन रहती है पता चलेगी। लेकिन उसका नंबर आए उसके पहले ही छाती में दर्द हुआ और उसने बोला डॉक्टर साहब डॉक्टर साहब। तो मैंने बीपी चेक किया, इट वाज टू हाई, इट वाज 200 and 130। तो मैंने चोंगमो को ट्रीट किया। कैसे ट्रीट किया? मेल पेशेंट वाज देयर, spleen 4 and the pericardium 6, 2 point only, spleen 4 it was the male patient, suddenly chest pain. So in the male, left is the dominant side, spleen 4 on the left, tonification, pericardium 6 sedation on the right। इतना लगाते ही ठीक हो गया, that's it, इतना ही लगाया। And luckily patient was so sensitive, he could feel the effect of energy, so he could explain very properly, oh, and I'm feeling much better। Many patients are not able to explain that what's happening. Okay, after some time they might tell you I'm feeling better, but this patient was very sensitive, he told, oh, I'm feeling better। उसने कहा आपका पेरिकार्डियम 6 लगाने के बाद मुझे ज्यादा अच्छा लगा। तो हम उसे थोड़ी पता चलेगा कि किससे अच्छा लगा, उससे अच्छा लगा। Whether we have, so what we want to tell, we have added 2 points, spleen 4 on the left, pericardium 6 on the right। These 2 points are good for this entire chain in between the uterus to the heart. Okay. If the female is having excessive heat in the heart, they might be having excessive menstruation. Can we treat spleen 4 pericardium 6? Yes. We can bring a spleen 4 and the pericardium 6 is the very good circuit system। ये एक बहुत ही शानदार सर्किट सिस्टम है between the uterus and the heart। Okay, definitely in the male, uterus is not there, then we can think about the male genital part। So on the top it's the heart, on the bottom is the genital part, For the female, we can think for the uterus. If the female is having some problem of the uterus, we can treat spleen 4 and pericardium 6. Spleen 4 and pericardium 6 are activating our parasympathetic nervous system. ये क्या होता है? Parasympathetic nervous system क्या होता है? In the human body, there are two types of nervous system. One, hurry, curry, bury, running. That is sympathetic. Okay. One opposite. Already heart is having too much heart here, too much beat. Even the person is already restless. Person is already in the hurry, curry, bury. We want to calm down the person. Then spleen 4, pericardium 6. It will activate the vagus nerve. It will activate the parasympathetic nervous system. And it will calm down the uterus, calm down the heart, calm down the digestion, calm down the brain. And person will be feeling relaxation. So now look at this image. So Chong Mai. On the top, it's having connection with the heart. In the bottom, it's starting from perineum. Perineum, we know what is perineum. And from the perineum, it's having connection with the heart. And perineum is having connection with the uterus, as well as with the kidney, with the force in between both the kidney. Got it? Now, it's a beautiful system. I will tell you why, how. On the back side, we are having Dumai. On the front side, we are having Chong Mai. Dumai means due meridian. ये हमारा due meridian, due vessel. On the front side, we have Chong Mai. If we stimulate the due Mai, it will activate sympathetic nervous system. And if we work on the Chong Mai, it will activate the parasympathetic nervous system. So uterus and heart both are having very balanced supply, and we can activate whatever we want. Suppose someone is suffering with a low BP. Low BP. Okay. Low energy. We want to ignite the sympathetic system. We will activate the DUMAI. We will add some point like DU4. Okay. In this way, we can work. Okay. So we'll keep discussing. Let's come back to Chong Mai. तो चलिए हम Chong Mai की बात करते हैं. So now we can see in this image, we can see this entire is the root of Chong Mai. ये जो root देख रहे हैं, this entire root is the root of Chong Mai. ये पूरी Chong Mai का root है. So there are many branches, branch 1, branch 2, branch 3. There are multiple branches. There Chong Mai की कई branch होती है. तो पहले चलिए let's see the branch number 1. Remember one thing, we are focusing on Chong Mai. It means we are focusing on uterus and heart both. So the branch number 1. The branch number 1 is the internal branch, which is not outside. ये अंदर होती है. It starts from the lower dantian. ये कहाँ से start होती है? Lower dantian means in between both the kidneys. Yesterday we have discussed what is lower dantian. So the branch number 1 is start from lower dantian and reaching to the ren 1. Okay, branch 1 is over. कल हमने समझाया था आपको, कल हमने डिस्कस किया था व्हाट इज लोअर dantian. There are 3 dantian. Lower dantian, physical strength. Middle dantian, between the heart, near the heart, emotional strength. Upper dantian, in the brain, mental spiritual strength. Remember yesterday we discussed? Yeah. Coming back to the lower dantian. Lower dantian means like a ball which is having 4 finger length, 4 finger width, means 4 finger from all side. That is one ball in the lower abdomen. हमारे lower abdomen में एक ball है. कहाँ पर है? नेवल से नीचे है, दोनों किडनी के बीच में है, in between both the kidney. Energy ball. On the back side we have DU4. On the front side we have CB4. Okay, उनके बीच में बॉल है. वहां से एक एनर्जी का पाथ आएगा कहां तक? रेन 1. रेन 1 कहां होता है? इन ऑन द पेरिनियम. रेन 1 कहां होता है? जहां हमारा मूलाधार चक्र है, वहां पर पहली ब्रांच आती है चोंगमो की. इसीलिए द पीपल हु इज डूइंग योग साधना, दे आर डूइंग सिद्धासन, दे आर कीपिंग द हील in the Muladhara chakra, and just you keep your heel at the Muladhara chakra for 20 minutes every day, you will activate the Chongmo. Even though 20 minutes is too much, even though I will tell you 7 to 8 minutes is enough, because the first branch of the Chongmo is coming from the lower dantian to the Ren 1. Ren 1 you might be knowing, still I will show you this point. एक बार मैं आपको पॉइंट दिखा देता हूँ. ये बिंदु हमारा मल और मूत्र मार्ग के बीच में होता है. हमें इसकी लोकेशन पता होना चाहिए. आपको कभी समय मिले आप अपनी एडी को यहां पर लगा के बैठ जाओ खुद ब खुद, और बस बैठे रहो. आपको लगेगा यार प्रेशर तो आ नहीं रहा, वो थोड़ा प्रेशर जितना रिक्वायर्ड आता है. दैट इज कॉल्ड सिद्धासन, है ना. सो लेट्स सी दिस. सो वी कैन सी हियर, this is the point. So we can see this is the anus. And this is the genital path. And this area in between the genital path and the anus, this is called perineum. And the REN one is located here. This is the location of CB1 or the REN. It's a very important point. जो फीमेल को सीजरियन डिलीवरी करते हैं ना, तो पेरिनियम में थोड़ा कट लगा देते कई बार, जब बच्चे का सिर बड़ा होता है और वो डिलीवर नहीं हो पाता, तो यहाँ पेरिनियम में डॉक्टर कट लगा देते. क्लियर? REN 1 is clear. So REN 1 is one of the great point. Now you are activating the REN 1, but you are activating Chongmo. It means you are working for your heart health. If anyone tell you, oh, I'm suffering with a high blood pressure, I'm having palpitation, okay, please do this. Do Siddhasan. Or forget Siddhasan. Just keep your heel at the perineum and sit. You can sit on the chair. There is no any issue. Or even you can't do that, you roll one small कुछ ऐसे वुडन पार्टिकल ले लो जो आपके लिए कंफर्टेबल, और उसे वहां रख के बैठ जाओ. बट द बेस्ट वे इज द हील, बिकॉज हील वी नो if we are having little bit discomfort we can adjust it. Okay. और योगी लोग यहाँ बैठते हैं, क्यों बैठते हैं? I will tell you. The Kundalini Jagaran, the spiritual enlightenment, when the energy is going upward, that is going with the power of spleen, because spleen is the power who is anti-gravitational. हमारे शरीर में जितनी भी पावर है आप देखो, उसमें एक ही पावर ऐसी है जिसे हम बोलते हैं द पावर ऑफ स्प्लीन, विच इज एंटी ग्रेविटेशनल, जो उल्टी चलती है. Okay. Lung is sending energy downward. Stomach is sending energy downward. Small intestine is sending energy downward. Large intestine sending energy downward. Kidney sending energy downward. Urinary bladder sending downward. Only the spleen is sending energy upward. Liver is sending all around. Definitely, liver is also very good and spiritual channel. But this is the place when you keep your heel here, it will activate the Chong Mo and will help spiritually. That's why it's called Siddhasan, which will help if there is a uterine prolapse, if there is any type of the prolapse, if the person is having palpitation, any problem, any type of the heart issue, it will activate the parasympathetic nervous system. अब कोई बोले कि मेरा तो पहले से ही सब कुछ लो लो रहता है, ओके, फिर ये फर्दर लो नहीं करेगा क्योंकि दिस इज कॉल्ड एडेप्टोजेनिक इफेक्ट. एडेप्टोजेनिक इफेक्ट मींस if the person is already relaxed, calm down, then it will not, ये further उसे और ज़्यादा calm down और relax नहीं करेगा. It will do the balancing, but for the person having cardiac problem, heart problem, high pulse rate, tachycardia means high heartbeat, they are very good. Do this. So the first branch of Chongbo, which is coming from the lower dantian and reaching to the perineum. Okay, fine. Now let's see the branch number 2. In the acupuncture, like in India, it's a little uncommon because in India, we can't put the needle everywhere. But in the China, they also put the needle in the Renwan. Even in the India, you can put needle in the Renwan, but you should have medical degree. Then you can put needle anywhere. Means MBBS degree. क्योंकि आपको पेशेंट अलाउ नहीं करेगा, भले एकदम सेफ पॉइंट है वो, रेनवन एब्सोल्युटली सेफ पॉइंट, लेकिन कौन अलाउ करेगा यहाँ पर निडल लगाना. और पेशेंट इज वेरी मच स्केयर्ड. इंडिया में हम सुजोग में लगा देते हैं रेनवन, लेकिन ये इतना गजब का पॉइंट है, अगर रेनवन पर हम निडल लगाते हैं तो इसके भी कई फायदे हैं. स्पेशली इट्स अ वेरी गुड पॉइंट फॉर इरेक्टाइल डिसफंक्शंस एंड इम्पोटेंसी. नाउ द पॉइंट नंबर 2, branch number 2 of the Chongmo. The branch number 2 is starting from stomach 30. ये ब्रांच स्टमक 30 से स्टार्ट होती है अब चौंगो की. देन इट्स आफ्टर स्टमक 30, it's going in the abdomen and chest cavity. It's going in the abdomen, and where it's going in the abdomen I will show you. ये पेट में चली जाती है. So now we can see in the abdomen. So from the stomach 30, this branch starts going in the abdomen, and in the abdomen it's following the kidney meridian. ये kidney meridian में से जाती है और ब्रेस्ट तक पहुंच जाती है. कहां तक पहुंच जाती है? ब्रेस्ट तक और चेस्ट तक. तो देखिए चौंगमो जो होते हैं ना, जितने भी हमने हमारी बॉडी में हमने कहा कि 20 एनर्जी पाथ बताए, 20 एनर्जी पाथ, 12 मेन, 8 एक्सटर्नरी. एक्स्ट्रा ऑर्डिनरी कैसे पाथ होते हैं? वो है ना साधु संतों की तरह होते हैं, उनका अपना घर नहीं होता, जिस घर में बैठ गए वही घर उनका है ना, ऐसे होते हैं, जहां बैठ गए वहीं खाना खाएंगे. आजकल वैल्यू नहीं है साधु संतों की, लेकिन पहले थी. पहले तो जिस घर में साधु संत आ जाते थे वो लोग बड़ा अपने आप को लकी मानते थे ना, धनभागी. आजकल तो लोग बोलते हैं चल आगे चल आगे चल. ओके, तो एक्स्ट्राऑर्डिनरी मेरिडियन से लाइक ए साधु, दे आर हैविंग ग्रेट पावर. उनका आशीर्वाद मिल जाए तो कुछ भी काम हो जाए. उनके पास अपना कोई पॉइंट नहीं होता. दे डोंट हैव देयर ओन पॉइंट, दे डोंट हैव देयर ओन फॉर्म। वो किडनी मेरिडियन में से जाएंगे तो किडनी मेरिडियन उनका, स्टमक में से जाएंगे तो स्टमक मेरिडियन उनका। लाइक वी कैन सी चोंगमो, चोंगमो पहले रैन में गया, रैन 1, फिर स्टमक 30 पे आया, फिर किडनी में से जा रहा है, अपना कोई घर नहीं उसके पास। सो इन दिस वे, so the second branch of the Chongmo is starting from this area of the stomach 30, then following the kidney meridian, both side, ending on the chest and breast. Any problem of the breast, you can use Chongmo. Any problem of the chest or the heart, you can use Chongmo. And stomach 30 is the very important point. It's near the uterus. So let's see in the other image. Yeah. So stomach 30 is the point. We can see this is the stomach 30. WE30 means stomach 30. Okay. And this is the stomach meridian. If we see the inside, the uterus is here only. uterus कहाँ पर होता है? देखो अगर आप इस इमेज को देखें, so look at here. This is the stomach 30. ये हमारी bone है. This is the bone here, which is called pubic bone. ये bone है, pubic bone. And stomach 30 is here, and uterus also located here. Uterus यहीं पर है, पूरा का पूरा. Okay. So the second branch is starting from stomach 30, starting from here. Then after that, it's following the kidney meridian. Now we can see in this image, stomach 30 is here. Then it's following the kidney meridian. This is the kidney meridian. Now you can understand how this Chongmo is very much important. We can see here. So kidney 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. 21 तक आया किडनी 21, उसके बाद चेस्ट ब्रेस्ट में मर्ज हो गया. So why I'm showing this root? Now person is telling you, क्या अब हम पेट की बीमारी ठीक कर सकते हैं चोंगमो से? Yes, we can treat the diarrhea, we can treat the constipation, we can treat the abdominal problem, we can treat the navel dislocation, navi ka खिसकना. We can treat all the problems happening here because just we have seen how the Chongmo is going from here, and the work of Chongmo to lift the energy upward. Chongmo का काम क्या है? ऊर्जा को ऊपर की तरफ लिफ्ट करके रखना. That's why now the person is coming to you with a problem of diarrhea. अगर आपके पास कोई आता है व्यक्ति कि मुझे डायरिया हुआ है, डायरिया, constipation. If the person is telling, can you treat my gas, acidity? I am having indigestion. Oh, I am having abdominal pain. If anyone is telling you this, okay, don't worry. We'll use Chongmo. Chongmo means spleen 4 and the pericardium 6. For the female, spleen 4 on the right side, pericardium 6 on the opposite side. And for the male, spleen 4 on the left side and pericardium 6 on the right side, on the opposite side. So we can treat the uterus problem, prostate problem, not only uterus and prostate problem, any problem the abdominal cavity, and any problem the breast and chest. And the main work of the Chongmu to bring relaxation, relaxation लेके आना, activation of the parasympathetic nervous system. Parasympathetic nervous system का मतलब क्या होता है? Like holiday पर जाना. You are going on the holiday because your body has worked a lot. You are always in the hurry curry. You are always in the running mode, but now you are relaxing. That is called parasympathetic mode. As soon as you work on the spleen 4 and the pericardium 6, it means you are activating your parasympathetic mode. So when the female are very stressful, they are suffering with the uterine problem, or sometimes they are suffering with the combination uterine and the heart problem. So that's why Chongmu is the main vessel. So today we have discussed only two branches. Now tomorrow we'll continue the discussion and we'll complete the discussion of Chongmu. Then one by one we will be discussing all the meridian having connection with the uterus. So thank you so much. Now we'll see you tomorrow. Clear everything? Any question till now? Okay, done. तो चलिए अब हम मिलेंगे कल. Thank you so much. Good night.